Welcome, everybody. My name is Benjamin Day. I'm the director of Healthcare Now. And we've brought together this amazing panel, or I should say, Public Citizen has really brought together this amazing panel to talk about a topic that I am actually just kind of learning a lot more about. I was really thrilled to see that Public Citizen had released a report on private equity and has brought in some experts on the topic of what impact private equity corporations are having on the healthcare system. To me, it had just been kind of nonprofit for profit for so many years and decades, and there was a big difference between the two of those, both in terms of insurance companies and providers. But private equity firms are this kind of layer of for-profit companies that have more of an impact on the healthcare system than I ever realized, and probably most of you out there listening have realized. So without further ado, I want to introduce our panel. First, we have Eagan Kemp, who is the healthcare policy advocate at Public Citizen. Thanks for being here, Eagan.
Hey, thanks.
Then we have Bob Seifert, who is a senior fellow at Americans for Financial Reform. Thanks, Bob.
Thank you.
And then last but definitely not least, Rachel Madley, who is the health policy advisor for Representative Pramila Jayapal. Welcome, Rachel. All right, so I'm going to start off by just kicking this over to you, Eagan. As I mentioned, I really need an education on this. So can you pretend like I know absolutely nothing about private equity firms? You and Public Citizen just released this amazing new report called Private Equity's Path of Destruction in Healthcare Continues to Spread. Tell us about that, and just what do we need to know, the very basics of private equity in healthcare?
Yeah, thanks, Ben. Yeah, it's terrifying. Is sort of the most important thing to know. And the further I got into researching this report, the more terrified I got. I had sort of similar to you, sort of a sense that there was something going on, and I was hearing enough about it. And then one of our other researchers did a report on looking specifically at nursing homes and just how bad things were, and how much there was sort of a lack of transparency there. And so, we really wanted to dive in, but I think it may be helpful for folks if I take sort of a quick step back and just sort of talk a little bit about what private equity is and sort of why they're engaged in healthcare. And so private equity firms, they also used to be referred to as hostile takeover firms. Some folks may be familiar with that, but they went through this whole PR rebranding to now be called private equity firms. And what they really do is buy out other companies and then move rapidly to turn a profit from their investment. And the most important thing is by any means necessary. They've been around for decades, but the evidence of their influence and power has really grown in recent years, particularly in healthcare. Uh, their business model and harms are sort of really tied together. They're incentivized to mismanage healthcare and other assets. They aim to take outsized profits very quickly without regard to the long-term implication for patients and communities. They generally aim to exit any of their investments within 3 to 5 years and want to have returns of at least 20 to 30% per year. Um, their investments in healthcare have actually been higher than their investments in other areas, and so that's why they keep driving money into it. And there's been record years the last couple of years in terms of private equity investment. They really also threaten providers in solvency, which is a big issue for the healthcare industry, both sort of short and long term. They often acquire health care entities and load them up with debt. They often borrow a lot of money to be able to do this. And so when they transfer all of that debt onto the balance sheet of whoever they're acquiring, it can really start them in a very difficult cycle. And they're instantly forced to dedicate a big part of their budget to servicing debt rather than serving patients. They also maximize profitability by raising healthcare prices. If you are have a doctor and all of a sudden your prices are up a third or double or something higher than that, they may have been taken over recently by private equity who are controlling a lot of the things behind the scenes, and it may not even be clear to you as a patient. It just all of a sudden you're getting hit with bigger bills, bigger service fees that never existed before, and that's really common across the healthcare industry. And so, one big question I often get is sort of why is private equity so focused on healthcare? And just as sort of a reference to just how big healthcare is, in 2021, total health spending accounted for 4.3 trillion in spending, over 18% of the GDP, and nearly $13,000 per person in the U.S. It's going to continue to rise rapidly as population ages and healthcare prices increase rapidly. It's one of those terrifying things that, and the further that private equity gets into healthcare, the more they're finding different niches within the healthcare industry that they can target. I'm going to talk about a few of those in the report, and then just there's a whole bunch of other interesting ones to check out in the report. But a couple of the biggest ones: first, end of life care, which is obviously particularly terrifying given their vulnerable nation of patients at the end of their lives. There's legitimate concern being raised by doctors, patients, advocates. Researchers have been finding that for-profit hospice firms target patients differently than nonprofit ones. And we're also finding similar issues for other services for our graying population, including gastroenterology, ophthalmology. As we age, there's certain services that we need, and private equity is really targeting those and targeting patients for profit. Another particularly scary one is home health care, because there's just not as many providers around. There's not nurses around, and so as these private equity companies get into nursing care, nursing home health care, a lot of them were previously involved in nursing homes and really made a mess of that. And so they've been digging into home health care more. Some recent research from the Private Equity Stakeholder Project found significant concerns about the quality of care decline when these home healthcare companies have been taken over by private equity. And there's really sort of a lack of scrutiny around sort of the overall investment of private equity in this area. Another area of particular concern are traveling nurses. One of the things that private equity really took advantage of, that folks may be familiar with, is a surprise billing, and they were able to sort of drive up prices and stick people with surprise bills. They're using some of those same tactics in traveling nurses, but really trying to stick it to the companies, the hospitals or other institutions that are having to hire them. And so there's been a lot of consolidation, which is a sort of another trend within within private equity's investment in healthcare, of buying up as many folks within a given market and then raising the prices very rapidly. And that's something that we've seen pretty consistently in traveling nurses. Another particularly scary one is reproductive care. There's less regulation around that in terms of the cost of it, and a lot of times it's not covered by insurance. So as private equity companies are able to buy up and consolidate reproductive care, there's evidence that they're actually prescribing different types of care than nonprofit providers, and that each round of in vitro fertilization or other services can cost tens of thousands of dollars, and it's often a very vulnerable population, people who are struggling to have a child, and there's evidence that private equity is taking advantage of that. Finally, just briefly on Medicare privatization, a lot of folks attending the conference will be familiar with ACO REACH and sort of the dangers around that. But we've been seeing that a lot of private equity firms have expressed interest. And so some of the companies that are trying to set up or buy up providers and then put them into private equity, into the ACO REACH program, it really begs the question what they're going to be there for. Are they just trying to take advantage of sort of the unclear rules around ACO REACH and get as much profit out as possible? Given sort of their background, that's what you could expect. If folks have interest in other areas, we also look at sort of anesthesiology, dentistry, dermatology, hospitals and hospital chains, and then a bit more sort of on the background around nursing homes. And so hope folks will check out the report. Looking forward to any questions, Ben.
Wow. I was going to say thanks so much, but I don't know if I'm feeling grateful for learning all of that, Eagan, just the scope of it. And you just kind of touched on so many different areas of our healthcare system that have been impacted. So, Bob, do you want to talk a little bit about AFR's recent work in this space of private equity?
Sure, I'd be happy to.
Great.
Thanks, Ben. And Eagan, thank you. That was a great scene setting for the discussion today. Yes, so Americans for Financial Reform is a nonpartisan and nonprofit coalition of more than 200 civil rights, consumer, labor, business, investor, faith-based, and civic community groups. AFR was formed in the wake of the 2008 financial crisis, and it works to build a foundation for a strong, stable, and ethical financial system that serves the economy and the nation. I've been working with AFR for the past half year or so on this question of private equity in healthcare. And let me just start by sort of echoing what Eagan has just been talking about with this very general statement. Private equity is incompatible with healthcare. This point has been made with clear and convincing evidence just a few minutes ago. And will be repeated, I think, several times during this session. And in countless academic articles, there's quite an extensive academic literature on this already. Journalistic exposés and, of course, personal experiences. We've seen increased mortality and reduced quality in private equity-owned nursing homes in the academic literature. We've seen increasing prices due to market consolidation. We've seen bankruptcies of sole community hospitals. The list goes on. And the reasons, Eagan touched on some of this, that private equity and healthcare are incompatible, are very straightforward. Private equity has a singular focus on maximizing profits. Some of the cost-cutting strategies in service to that goal, for example, shrinking staff, shifting staff to less skilled care delivery, in pursuit of this goal, compromises quality and safety. The debt financing and real estate transactions that we heard about impose financial burdens and divert resources that might otherwise be used for patient care. And the short-term ownership framework of private equity is, of course, not conducive to the long-term improvement of healthcare and commitment to the community. So AFR is working with its allies in an effort to remove private equity from healthcare, or at least minimize the influence of private equity in healthcare. AFR just submitted comments to the proposed CMS rule, new CMS rule requiring disclosure of nursing facility ownership, controlling entities, and other disclosable parties, and requiring owning and managing entities to disclose whether they are a private equity company or a real estate investment trust, sort of acknowledging the special threat of private equity to nursing facilities. This transparency, of course, is important as it makes private equity owners accountable, shines a light on the stealth consolidation that's going on in various corners of the healthcare world, and enables regulators and consumers to look at overlapping and interlocking ownership as well, the relationships between facilities and management and staffing companies, and other opaque kind of structural features that promote profits at the expense of patients. Public comment period on this proposed rule just closed. Once the rule is finalized, the information that's now required to be collected is supposed to be made public within 1 year. This rule applies only to nursing facilities. It was a section of the Affordable Care Act that this rule is now finally implementing, but theoretically can be made part of the Medicare eligibility application process for other providers as well. And I'm guessing that maybe we'll hear some of that from Rachel in a few minutes. We're also looking forward and expecting another rule related to in this area to be proposed this spring, coming out of CMS, probably addressing minimum staffing levels in nursing facilities, with a focus on safety, of course, but also getting at kind of a key private equity cost-cutting move. So we're looking forward to seeing what comes out of the federal government on that. I'd like to spend a few minutes here also talking about the work that we've been doing to identify federal policy levers to curb private equity, with, again, specific focus at the federal level, That's the work that I've been doing. There are a lot of things, a lot of other state policy opportunities as well. There'll be a report coming out of AFR in the late spring or summer. We're zeroing in on 3 general areas. The first being changing payment incentives in the Medicare program. There are payment incentives both on the fee-for-service side in traditional Medicare, such as how physicians are reimbursed for prescribing drugs out of their office is an opportunity. Eagan made reference to this, is private equity firms sort of look for these opportunities to seize profits, to really take advantage of these kinds of loopholes. So that's one. The site of care where care is delivered, higher payments for hospital-based outpatient care than physician's office for the exact same service. Those kinds of things are incentives that draw private equity and other private owners in, and can be changed. On the Medicare Advantage side, where there are capitated payments, the methodology for developing those payments provides an opportunity for gaming through aggressive risk coding. This is kind of technical stuff, but basically the health, how much risk there is for serving a particular panel of patients determines how much a Medicare Advantage plan is going to be paid. CMS has tools available to neutralize this risk code gaming. Something called the coding intensity adjustment is one of these tools, and it can also increase its overpayment audits, efforts to recoup overpayment from Medicare Advantage plans that are paid for this coding aggressiveness that isn't really clinically supported. So that's one area. Second area is stronger enforcement of existing federal laws. I'm going to try to get through the rest of this pretty quickly. Anti-fraud laws such as the False Claims Act and the Stark Law, which prohibits self-dealing of healthcare facilities and practices. These are laws that are in place and can be applied more aggressively by the Department of Justice, HHS, Office of Inspector General, and so forth. And penalties the penalties that are sought can be greater than what has been sought in the past. Many of you have probably seen the private equity stakeholder group report on False Claims Act settlements over the past 10 years. There's a lot that's been done. There's a lot more that can be done, both in terms of False Claims Act and Stark. And then the other area of enforcement would be in antitrust laws. Although many private equity acquisitions of healthcare practices are too small to trigger federal antitrust review, states can do that at a different level. But the Federal Trade Commission can publicize this. It can study non-reportable mergers for a better understanding of their effects on consolidation. HHS, in addition, in its capacity as overseer of healthcare quality and safety for Medicare, can expand its reporting and approval requirements for healthcare mergers specifically. So there are things to do in antitrust, short of changing the law, which is a pretty heavy lift. Finally, ownership transparency is the third area. I'm not going to go into that too much because I think we're going to be hearing a bit about that from Rachel. One thing that I want to bring up though is the Medicare and Medicaid exclusions list that HHS maintains. That is a list of people and entities that are excluded from participating in Medicare because of past violations of some of these rules and laws that I've been talking about. It isn't very well policed and enforced. It isn't very well publicized. I think that's an area, just again, in terms of sunshine, that would be effective in trying to make sure that people who have already done bad in this area can't continue to do that. So as I said, report coming out from AFR probably in the next couple of months. AFR is also looking for partners and allies for its work, combining the financial expertise in a group like AFR with the healthcare world. So feel free to be in touch with me. The private equity campaigns manager at AFR is Ricardo Valadez, and he'd be happy to hear from you as well. And I can provide that contact information if there's a way to do that before the end of this session. Thanks very much for your time. Looking forward to any questions that you might have.
Oh, great. Thanks so much. I have a lot of questions, but I'm going to hold them for Rachel. When Eagan was talking, he said, if your physician doubles its prices, then maybe they've been bought out by a private equity firm. And my reaction was, you mean we won't even know if we've been bought out by a private equity firm? And these are obviously providers who we have to have trust relationships with as patients. So Rachel, can you, I think your Rep Jayapal has some legislation that kind of touches on this. Can you tell us a little bit more about that?
Definitely. And thank you so much for having me to talk about this really important priority for Congresswoman Jayapal. So recently, the Congresswoman introduced the Healthcare Ownership Transparency Act. And as everyone has been talking about and alluding to, there is a lot of great outside research about private equity's involvement in healthcare, but we truly don't have transparency into how large this problem is. We don't know what firm owns which hospital, and if I had to bet, I would say it's probably a much larger problem than we can even imagine right now. And so what the Healthcare Ownership Transparency Act does is it takes the first step in solving the issue of private equity in healthcare. It does that by bringing in transparency. So the bill would require that any healthcare facility that is owned or partially owned or has a private equity firm with an ownership interest in that facility, it requires disclosure of that through the pre-existing Centers for Medicaid and Medicare Services PACOS system. And PACOS is PECOS. It stands for Provider Enrollment Chain and Ownership System. Now, the great part about this bill is we're not creating a brand new system to store all of this information. The PACOS system is an existing system where all healthcare facilities that receive Medicare or Medicaid dollars, which is virtually every healthcare facility in the country, they're already using this system to share information about the facility. So what this bill would do is it adds very important information that we will get from the healthcare facilities. Now, this includes, like I mentioned, disclosure of private equity involvement or ownership stakes in the healthcare facilities, but it goes a lot deeper than that and tries to understand what other interests could those private equity firms have. And so some of the questions that are required in the bill are things like the firm's losses over a year so that we may anticipate, are they going to try and sell off this healthcare facility very quickly and in turn harm the patients? It even goes as far as asking about the political contributions that that private equity firm may have made, which is another very, very important indicator of things that the private equity firm may be doing with the healthcare facility that are not based on a patient's best interest or a doctor's best interest. And so we're really excited to be leading this bill because not only does it require that information, but it will also direct the Secretary of Health and Human Services to initiate a task force to look at the effects of private equity in healthcare. And we know from great research already that in nursing homes, mortality spikes as soon as private equity comes in and starts to either own or have a partial interest in that nursing home. But we don't have a lot of other visibility into different areas of healthcare. So this task force would look into that and then create recommendations of how do we address this issue? How do we solve this problem? The third and final part of the bill is it gives the Secretary of HHS the authority to prohibit private equity firms from purchasing outright or even having a partial interest in healthcare facilities until the task force puts out its recommendations. So essentially, we can hit the pause button so that this problem does not get any worse and allows the government to have time to understand what's really going on, put out recommendations so that we can, again, be protecting patients and doctors from a lot of the harms of private equity involvement in healthcare. And I will say, this is a huge issue in healthcare, addressing Medicare for all, but also just in the general system, right? The rises in mortality, a lot of doctors are actually having to change jobs or leave the medical field because when their practice is bought by a private equity firm, it makes their job impossible. They can't give the medications that they need. They can't possibly see as many patients as they're given because the staffing ratios are insufficient. And so it's creating a large issue. But if we think about Medicare for all, and of course in the Congresswoman's office, we're always thinking about that because she leads the House bill, we can't have a successful Medicare for all system if we have these private equity firms acting in the weeds, doing all of these things that we don't really have visibility into. Because as we've learned, for-profit entities in the healthcare system are going to do whatever that they can to wring out as many dollars, frankly, from the healthcare system. And so if we have this black box of private equity involvement in our healthcare system, of course, Medicare for all is going to solve a lot of issues in our healthcare system, but it will be a very, very big obstacle if we are to introduce a Medicare for all system and we have no idea what private equity is doing in our hospitals. And not just for-profit hospitals. This can be nonprofit hospitals. This can be independent physician practices. And so when we think about Medicare for all, we typically don't think about private equity firms because, again, it's really in the weeds. But the Congresswoman has said what these firms are doing in the weeds is having a huge effect on patients and the future of our healthcare system. So we're really excited about the Healthcare Ownership Transparency Act. And we are excited because a lot of other members of Congress are starting to wake up to the dangers of private equity in healthcare. And so we're going to keep pushing the bill forward as far as we can. And hopefully we will be able to turn it into law or see administrative regulations come out. As Bob was talking about, the Biden administration has already taken steps to improve transparency on private equity firms in nursing homes. And we think that we should go further either through the Healthcare Ownership Transparency Act or through administrative actions. And so I'll turn it back over to you, Ben. Thanks so much.
Great. Well, thanks so much for telling us about that legislation. That's really interesting. I have some more questions later about that as well. So I'm going to direct some questions to y'all, but feel free to also ask each other questions since experts asking experts is better than a new Bobo on private equity asking the experts. But at your very opening talk, Eagan, you said that private equity firms, when they buy up a healthcare entity, they are generally looking to make a quick profit and then exit within a few years. This begs the obvious question: what happens to the healthcare facility when the private equity firm exits? What does exiting even mean or look like?
Yeah, no, and it can mean a few different things. A lot of times it means, depending on sort of how big the facility is, that they may either be selling it to somebody else, and so they've already sold the actual hospital physical infrastructure, and so are charging this hospital now rent or leasing it sort of back to the providers, and then they may turn over that to offer it to the providers to buy. That's something that we've been seeing, which can often be very challenging for those providers to then sort of be saddled with the debts that the private equity company put on them. And so even if they're able to buy it back and start sort of redoing things, it's very challenging for them to get sort of out from under that debt. The other thing that we see in rural healthcare and some urban healthcare facilities, hospitals particularly, is that they end up closing. That it's been stripped for parts. They may have consolidated with sort of the closest other hospital. So maybe there was a decent pediatric wing of a hospital, and so what the private equity company did is bought that hospital and maybe two or three others in the area. And so what they did is move that private equity wing over to one of those other hospitals, and so now that's less it's a less profitable hospital, and so then they go through the process of closing either that part or sort of the whole hospital. And it can mean that all of a sudden people in rural areas in parts of America, may already need to travel like an hour for healthcare, but now if they're closing down facilities, you may be traveling 2 to 3 hours, which obviously in the case of an emergency can really mean dire circumstances. And so sometimes there is sort of more of a process for them to exit, but sometimes it's just a sign on the door that says this hospital is now closed. And there's even been stories of, ambulances sort of having to figure out where to go, that one of the hospitals that they thought was open is in the process of closing, or that part of the hospital that they needed is closed, and then having to figure out. And so it can be dire for communities, dire for patients, dire for providers.
Wow. So I guess that leads to another question, and maybe I'll direct this at Bob first. Yeah, I guess since it sounds like private equity firms, they're not building their own healthcare practices at all. They're sort of swooping in and buying up corporations and providers that are already experiencing some sort of dire situation or financially struggling. So, and maybe that's the incorrect assumption. Maybe I'll ask that question first. Is this mostly struggling facilities that are being bought up, or?
Not necessarily.
No?
I think it might depend on the industry, and it really sort of depends on the opportunities. The list of different specialties that Eagan gave before, dermatology, gastroenterology, ophthalmology, are all areas that are sort of very, very attractive, not necessarily because the practices are struggling. They may be, but it might also just be an interest in the practices and the owners of the practices, the physicians who own the practice, to offload some of the very heavy administrative requirements that practicing physicians now have, or they're getting ready to retire and they just want to kind of cash out. So it's not necessarily a distressed situation. These are leveraged buyouts. I mean, this is what we heard the term hostile takeover before, but these are also leveraged buyouts where it's just it's a financial transaction, really, that is attractive for some reason, but not necessarily because of a distressed situation.
Okay, well, that answers my other question, which is why would anyone sell to a private equity firm knowing what's likely to happen? But I think you kind of described the situation well there.
Just one thing on that one, Ben. Yeah, it's really, they really do want to consolidate a market. I mean, so they may be going after even some of the big fish in a particular area, because that helps them then, if they can control 60% of the gastroenterology market in a particular region, all of a sudden they can raise those prices, and since a lot of folks are already they're gonna keep their doctor, and they might even just be able to sort of get a lot of that out of insurance, even if it's not necessarily out of patients' pockets. But in the long run, that's going to be out of patients' pockets, because those insurers are then going to increase their premiums and their out-of-pocket things over years. And so, yeah, it's a dangerous approach, and it's something that I think is affecting far more providers. I mean, one of my spouse's providers, we just sort of connected the dots and realized that one of the private equity companies was buying up a bunch of things in our area. And it wasn't until I sort of looked through, some of the private equity stuff that we did as part of the report, where I was like, aha, that's why this person, so all of a sudden changing things. And then that provider, I think, didn't like what the private equity company was doing, and so now they're moving out and starting their own practice. And I was like, that's pretty telling and pretty terrifying.
Wow.
And if I can just add really quickly on Eagan's point about consolidation, many people don't know that the Federal Trade Commission, and Bob spoke about this a little bit, does not have jurisdiction over mergers and deals between nonprofit healthcare facilities. And so there's an immense amount of anti-competitive activity going on that the FTC, just because of its authority, cannot act on. And so Congresswoman Jayapal is also leading a bipartisan bill called the Stop Anti-Competitive Healthcare Act. It's a one-sentence bill that just gives the FTC the authority to look at those consolidations and mergers, because of everything that Eagan just said, because that's happening with no oversight. And we know it's driving up prices. We know it's causing patients harm, but there's nothing that anyone can do about it right now.
Wow. Yeah. And the idea that private equity is playing a role in the nonprofit sector too, I had no idea about that, Rachel. So thanks for that additional scary level of what's going on. We actually, we did a podcast earlier in the year on pet insurance. And apparently veterinary facilities are being bought out by private equity. And those are actually some of the worst actors that you will run into for your beloved cats and dogs as well. So I guess one of the question I had was, I was trying to keep track of all of the kind of signs that your provider may have been bought out by a private equity firm, just like the tactics that they use to try and turn this dramatic profit in a very short period of time. And I was just kind of taking notes as I went along. Eagan, you talked about raising prices, maybe dramatically raising prices. Bob, you talked about slashing staffing levels as a common tactic they use, as well as upcoding in Medicare Advantage plans. Are there other kind of tactics that they're using that really have an impact on patients that come to mind?
Yeah, another one that comes to mind is just sort of brand new fees. So not just increased prices for the things that you're normally getting, but just sort of a $600 service charge, or or you may be starting to get pushes from your provider for like signing up for like apps or like other things. They're sort of what they call revenue cycle management companies that private equity firms are. They own those managed revenue cycle management firms, but then they also try to have their healthcare owned facilities use those services in the loosest sense of the word. Another thing that you'll probably see is very aggressive debt collection. All of a sudden, we've heard stories of sort of hospitals starting to increase debt collection. And as folks have been looking into that, one of the common themes is that that the hospital or other institution has been bought out by a private equity firm, and or they've contracted with one of these revenue cycle management companies, which really do just focus on getting as much money out of people as quickly as possible. And that even goes for nonprofit hospitals that are supposed to have sort of charitable care provisions. And there's even been reports that these companies that they've worked with, these revenue cycle management companies, will either not tell patients or sort of will really hide the ability of patients to get the charitable care that they're actually entitled to, and then just trying to nickel and dime them and put them on payment plans that shouldn't even be necessary.
Wow.
I would also add to Egan's list, which was great, one more, not just upcoding, but upselling. Recommending advanced procedures, expensive procedures, maybe with an affiliated practice, again, that may or may not run afoul of this Stark law, which government should be paying attention to. But very common in dermatology practices, for example, to kind of sell these high tech, very expensive procedures that may or may not be necessary, absolutely clinically necessary. Additional biopsies of kind of question, all of those kinds of things, or like extra stuff that can be sold.
Yeah, Bob, it's a really good point, and that reminds me. I heard of I think it was Bloomberg was talking to a dermatologist, and they said once private equity bought them out, they were looking for pre-cancerous things and doing biopsies or scans that were not medically indicated.
Wow, and I'm kind of struck by almost all the things you've talked about. They are used by providers and medical facilities, not private equity firms. These are tactics that we kind of see around, but it sounds like they're just put on steroids especially when they know they're not going to be around. So they don't need to maintain relationships with patients. They don't care if they perhaps alienate their employees and their customers. So we just kind of see all of these least ethical bridge burning tactics used to the maximum degree. So Rachel, I had a question for you as well. So in the Medicare for All movement, we have the pleasure of going up against, obviously, the health insurance industry, the pharmaceutical industry, and probably quite a few others, lots of middlemen in the system who might be impacted by a Medicare for All system. When you're trying to just add a layer of regulation for the private equity firm, how big is this industry, and how much of a lobbying sort of a punch do they pack?
That's a great question. And it's really quite scary because the private equity industry has a very large amount of power. And this is not to discourage anybody who's listening to this, because I think
Yeah.
the private equity industry has power through money and connections. And a lot of times their goals are very similar and aligned to our other enemies' goals. Health insurance companies, pharmaceutical companies, they're all looking for ways to make as much money as possible. And sometimes they can do this through similar methods. So a method that a private equity company is using, such as upselling, can also help a health insurance company as well, and things like that. But I will say that private equity firms, as much power as they do have through, again, mainly money and connections with folks, there is no one out there who loves private equity, right? Like there is not a private
Right.
equity for all conference that's happening, like a Medicare for all conference, where people are saying, you know what, we need more of, we, the people who are using healthcare services every day, who are in medical debt, who are struggling to afford our prescription drugs, we need more private equity. And so I think that's the stark contrast. And so they are a large enemy, but they don't have a lot of the people power to back them up. And one story that I like to tell from my days before I worked for the Congresswoman was in New York. We were lobbying again for single payer healthcare, and we had tens, maybe hundreds of people showing up at the Capitol for multiple days every year. And all that the health insurance industry had was a billboard on the back of a pickup truck that just said single payer is bad, basically. And so I think that's the biggest contrast. And I think this conference and all of the activism that goes on in not just the Medicare for All movement, but the movement for health justice overall, which is very, very large, is enough to counter private equity's involvement. We just have to be smart about it and know where our strengths are. And so that all is to say, private equity, they're a big enemy. I would lump them in very similar to our pharmaceutical and health insurance industry enemies, but they're not unbeatable. And we've seen that in some steps that have been taken recently. The pharmaceutical industry lost, frankly, in the Inflation Reduction Act, because now Medicare can negotiate drug prices, not as far as we all wanted it to go, but they lost. And that's very rare. The health insurance industry recently suffered a partial loss with the new Medicare Advantage risk scoring announcement from the administration. And so we have the power to take them down. It's going to take a lot of work, but they don't have the people behind them. And I think that's the biggest thing that we have on our side.
Great. And as you were just saying that, Rachel, I wanted to ask, does this bill fall strictly on partisan lines, or do you sense that there's some bipartisan interest in putting some reins on private equity?
That's a good question. So our bill specifically only has Democrats on it right now, but I do sense that there is growing interest across the aisle in the Republican Party to start looking at these issues and doing things to stop them. So as I mentioned before, the Congresswoman's bill on hospital mergers that are anti-competitive, the Stop Anti-Competitive Healthcare Act, is bipartisan. And that's something that a lot of folks on the other side of the aisle are talking about, looking into, and really noticing that we have to stop. And so there is a growing bipartisan interest. And right now, since the Republicans control the House and the Democrats control the Senate, you want to look at those bipartisan solutions, because those are the things that we can move right now while we're working toward our longer goal of Medicare for all. So it is exciting because I do think we're starting to see the bipartisan wheels turn.
Yeah, I think one sort of important point on this one is the private equity has had losses in this area. Sort of one of their biggest initial forays into healthcare was surprise billing, and obviously the Surprise Billing Act was signed by President Trump, and so there is once it's sort of scary enough and people are aware enough, and people are sort of really feeling the hit on this and are aware that it's private equity that's doing it, there can be enough political pressure. And private equity, they don't care who they're taking advantage of. They just need someone to take advantage of. And so if we can make it much tougher for them, or sort of cut off their avenues of profit. If their profit goes down even 2 or 3% in healthcare, they're just going to move on to the next industry. I mean, you're already hearing strange things about them, like buying up kids' indoor play areas because they think they can make a profit. So they don't care. So if we just make healthcare toxic to them, they'll get out much more quickly than some of the other bad actors.
Yeah, let's stick them on those kids, but stay away from our healthcare. I'm just kidding. But Rachel, I take your point that the private equity fan club is very small. That is fundamentally different from a lot of other healthcare actors, even that we have to go up against. Even hospitals who are somewhat bad actors do have goodwill with a lot of their patients. So I just wanted to close with a couple of final questions. Bob, I wanted to ask you what AFR's report is going to talk about and kind of what we could look forward to in that.
Right. So the report is really going to look at the federal policy levers that are available for reining in private equity along the lines of what I outlined in my remarks. We want to focus as much as possible on administrative and regulatory levers as opposed to legislative levers, just because of the relative ease or difficulty of accomplishing those things. But there are some of the Medicare payment things that I talked about would require congressional action, and there are other things that would as well. But that's the gist of it. Is going to be focusing on federal strategies to rein in private equity. Not so much on the state side, at least not this time around.
Right. Okay, great. Well, we're looking forward to that. And Eagan, is there any other legislation out there on the legislative front aside from Representative Jayapal's bill that would have an impact on this private equity mess?
Yeah, there's a few other pieces of legislation. Obviously, most important was, Rachel already mentioned, Medicare for all. That would really sort of change up the government's power around this. And as Medicare for all, the Medicare for all legislation right now bans the use of Medicare dollars in service of profit, that would have a huge impact and would drive private equity, because all of a sudden it would become much more difficult for them to do the things that they're doing. Another big one that is sort of broader in scope is the Stop Wall Street Looting Act, sponsored by Senator Warren and Rep. Pocan. That one really is sort of focused on accountability really across private equity companies in sort of any industry. It would require firms to share responsibility for the liabilities of the companies under their control. It would limit their ability to load debt onto acquired entities and abandon them to go bankrupt. It would also better protect workers and consumers in the event that an acquisition does go bankrupt, something that is relatively common. There's also a couple sort of smaller bills, one that would look at focus on health and location data protection. Private equity is really getting into healthcare data and sort of connecting it to other parts of their business in scary ways, and not always having sort of the level of protection that your healthcare data, your very important, private data, should be protected. That one's also Senator Warren in the Senate and Rep. Scanlon in the House. And then finally, there's a Medicare Advantage Consumer Protection and Transparency Act, which was put forward by Rep. Katie Porter, which would increase the information available on Medicare Advantage plans, including claims, denials of care, and coverage. Patients would be able to make better decisions if they're going to be signing up for Medicare Advantage. And Medicare Advantage is another area where, as folks alluded to, upcoding and other things are happening where there's implications and incentives for private equity to take advantage of the system. So there's a lot of other ones out there, but these are some of the key ones that we're tracking.
Great. Thank you so much. And thanks to the whole panel. I learned so much. I really had no idea that this was so widespread and having such an impact on our healthcare system. Since, as you said, it's kind of all behind closed doors, behind the scenes, and even people who want to learn about it, it's sometimes hard to find that information. So I appreciate it so much. Thank you all. And I hope everyone enjoys the rest of the conference as well. I'll take care of y'all.
Thanks, everyone.
Bye-bye.